Hey guys, Dr. Colton Ramps from here at Epic. We are here today on our YouTube channel going to chat a little bit about this case. So this is a calf roping mare, junior rodeo horse. I got a call first thing in the morning last Thursday, so a week ago today. Client was panicked. Horse had gotten kicked. They'd seen the horse get kicked by another horse out in the pasture. She'd come up 4 out of 5 lame, so that's significantly lame at a walk. We'll drop a video that the client sent me that morning. Obviously, client's super concerned. Told her, all right, let's load it up, bring it in, get it checked out as soon as we could. So we were able to check it out for her that morning. Took some x-rays. So you can see right here where that skin's broken. This is the point of Hock, the calcaneus. So I was right over the calcaneus. Now there's some important soft tissue structures that run down the back of this here, so we're going to want to ultrasound those. But the bone itself does not appear to be affected. It's always important to evaluate the whole picture, not just right where that trauma is, right? That's where the shoe that kicked her broke the skin, but that's probably not the only spot that shoe hit her. So you want to make sure you look at the whole Hock, whole x-ray, and make sure there's nothing busted in there. Which she looks like she is in good shape. So now we just got to check the soft tissues back there, make sure that looks good, make sure she does not get an infection there or address the infection that's already started there if we do have evidence of infection, which in her case we do have some evidence, and then keep moving forward from there. Monitor closely, do the other therapies that we can, so MagnaWave, laser on that wound, cold salt water spa, sweat wraps, all that kind of stuff to try and expedite her return to work, expedite her recovery, and get the best outcome that we can in this case. Luckily, nothing was broken. Based on how she was walking, there certainly could have been a fracture. It didn't look like anything was, unstable, etc. Otherwise, we would have probably had to go to her. Ultrasound, x-ray, everything was pretty darn clean. A little bit of contusion or bruising to one of the tendons on the back of the Hock. But other than that, pretty good. She's got this little wound back here from where that horseshoe actually caught her. You can see that's healing up pretty nicely. Little bit of soft tissue thickening around there. The day following that kick, she did have quite a bit of swelling all around here. So that's, what we would call a cellulitis. Basically some bacteria get introduced into that wound and start an infection in the subcutaneous tissue. They can also get really sore, really lame from that. That's also a medical emergency. If you don't handle those immediately and aggressively, then sometimes those will get way out of control and they can get past the point where you can actually get them resolved. Luckily, super good client here. She was able to get her into us pretty much immediately. We were able to do everything that we needed to do for this horse, rule out any significant trauma, start attacking that infection as soon as or even before it really started to develop significantly. We've been tracking this mare's SAA, that's a serum amyloid A. It's a systemic inflammatory marker. So that goes up pretty quickly and then drops down pretty quickly whenever there's some sort of cause of systemic inflammation. So we can use it to monitor clinical progression of the horse. We can use it to monitor response to treatment. In her case, she was about 2,400 on her SAA when she initially came in. High normal is 20. So that's 100x what it should be. With cellulitis, with those sort of kind of inflammatory conditions, we do see some pretty significant elevations in SAA, as in her case. And over the last week or so, that's dropped from 2,500 down to yesterday she was at 1,200. So we've seen about a 50% reduction in that, which is good progress. She's moving great. So again, you saw that video that the client sent me. Yes, walk her down here and then we'll trot her down that way. Moving quite well now. You can see compared to how she was walking in that other video, she's quite comfortable. Very happy that we were able to get her in pretty much as soon as the trauma happened and start treating it, aggressively and in a timely manner. But these are things that happen all the time. I mean, horses that are housed together kick each other, and it's sometimes it's bad. Sometimes there is a fracture. Sometimes there's significant injury, etc. Sometimes it's a little bit more simple, like her case was. But either way, had we not been able to get in there and take care of this, it could have spiraled and gotten out of control, and we'd be talking about a whole different outcome for her. So very, very happy with this case. She's a sweet little mare too, so we like having her around.